Hello, namaste. A very warm welcome to all of you to Times Business Awards North 2025. And today, right now, I'm sitting next to one of the amazing leaders, Dr. Gagan Saini, Vice Chairman, Radiation Oncology at Yashoda Medicity. Hello, sir. A very warm welcome to you. It's an honor for having you here and being in conversation with you.
The honor and pleasure is mine. Thank you.
So, sir, my first question for you is, why is cancer such a scare?
Well, the cancer is such a scare because whenever we know about a case of cancer, we almost know it to be an adverse case. And that is because the good cases, the patients who are getting better, generally are not talking about it. They get better, they're living right across your house. They will never tell you that they are a survivor. But the person whose case becomes adverse or as things go south, they will talk about it, or rather they cannot hide it.
Yeah.
And that is why there is probably a sort of a reporting or an understanding bias in the society. Because at the end of the day, in my practice, in the practice of an oncologist, you see many cancer patients getting cured. So it's not like patients don't get cured, but that's what is the general impression, and that's why people are always scared.
Yeah, and even people are talking all about the negative sides. That is the reason that it is kind of developing a scare in the hearts of people.
Yes.
So my next question for you is there anything that we can do to avoid cancer?
Certainly. There is at least some things we can do to avoid cancer. Well, one thing almost everybody knows, which is to not consume tobacco in any form. Tobacco in the chewing form, it gives you mouth cancer, throat cancer. Tobacco in the smoking form gives you lung cancer, esophagus, and stomach cancer. It gives you many cancers. It accelerates many other cancers as well. But there is one more thing which is equally bad as tobacco, which also we can avoid. And that is to avoid a sedentary life. And when we say a sedentary life, we mean the life where we are almost always eating and resting in front of the TV or maybe on any furniture whatsoever. So the idea is to stay active every 1 hour of the day, maybe keeping a total active time of about 90 minutes. If we can do that, that would avoid a lot of sedentary life-related issues in our health.
So I also believe the same, that due to the poor lifestyle of people, most of the diseases are coming through that only. And right now in today's generation, the toxic work culture is also contributing to it. But people should start actually adjusting with that lifestyle, right?
I do agree that a lifestyle of stress which the current work culture brings sometimes can be very bad, because it pushes you towards bad habits like overeating, psychological eating, usage of tobacco, substances, alcohol abuse. And these are the type of things which cause lifestyle disease. And one of the most important lifestyle disease after the heart issue, is cancer, no doubt on that. We at Yashoda Medicity have a dedicated cancer center, and that cancer center spans over 4 floors. As part of the building, integrated, but is separate administratively and for the patients, with special care being taken for the patients who are probably going to be ill due to cancer and can have more infections. So more filters are created in that area. So it's what I'm trying to say is it's a dedicated cancer center in the Medicity.
So my next question is, why do some people get cancer with tobacco and some do not?
Oh, that's a very interesting question. Thanks for asking this. So many a times I get people asking, and many people must be asking themselves that, oh, I am the one who's gotten cancer, or say person X has gotten it, but their peer group, so many people are chewing it, and why is everybody not getting it? Well, the reason for that is, it's at the genetic level, or the other person will get it probably later. We really don't know the reason why one person gets a cancer at one point and the other person does not get it or gets it at the other point. But one thing is very clear, that when you are using tobacco, you are 28 times more likely to get cancer. So no confusion about the causation correlation of
the time span also.
And the time span also. Someone will get it later, someone will get it early, someone will get a mouth, someone will get a throat. What they will get is a little bit in the hands of God, but something or the other will happen.
Precautions are in our hand. That's what we can do. So, when do you offer radiation therapy to patients?
It's interesting that radiation therapy as a modality needs to be offered to majority of patients in India because we are still diagnosing these patients a little bit slightly later. So many patients help, the radiation therapy helps many patients because it's slightly advanced cancer which can leave some cells around the tissue which has been removed, or it's a large enough cancer which cannot be resected. So you give radiation and to shrink it. So radiation therapy is done according to one study in 70 to 80% of the patients. The problem is not radiation therapy. The problem is the planning of radiation therapy and how the radiation therapy is given to a patient. It's interesting that suppose I give you a medicine, say a paracetamol 650, which everybody has been consuming since COVID. So I give it to you. So all you have to do is just take it with a glass of water. It's a piece of engineering by itself, which goes in your body, digests and relieves the medicine in its own way. Whereas radiation therapy is not a tablet. Radiation therapy, dose we know, but how to give it in an individual patient, for each individual patient, we have to create that tablet, so to say. So that planning is the most important part, and that's where technology and team comes in. Good technology and good team brings forward safe radiation therapy. Technology like MR-Linac in Medicity Yashoda is very breakthrough because it integrates MRI imaging, which is the most advanced form of imaging, with radiation therapy, and that adds to the precision. That adds to also one more understanding that as the tumor is shrinking over radiation therapy, the MRI can see it and adapt the radiation accordingly, thereby decreasing the toxicity as well. We also have what is called as surface guided radiation therapy in Medicity, and that surface guided radiation is unique because when you are breathing, your surface can be seen by the camera and the radiation therapy can be altered according to that. There is something called as an ExactTrack technology, which tracks the tumor up to less than 1 millimeter, which I always say is less than the thickness of my nail. So even with that heartbeat that you get, that movement of the skull, if you're taking radiation to a small thing in the brain, even that can be tracked. So technology is a very important part of radiation therapy. Good teams and good technologies makes all the difference. We do have that in our center.
So I think Yashoda Medicity is the ultimate.
It's the future of healthcare.
Yes, exactly. So the next question is, should patients be scared of radiation therapy? Because a lot of patients get weak and their strength decreases after the radiation therapy. So what do you think?
It's a very nice question. So I'll answer it in two parts. The first part, mostly we have talked about that, we don't need to be scared when there are good teams and technologies behind you, because what we are doing is minimizing the side effects. Minimizing, but still you will get some. And those are the side effects which you are talking about are, leading to weakness. So they are not really causing weakness. So radiation therapy by itself is not something that is draining you, because that's what it's easy to imagine that somebody is getting radiation and their tissues are getting drained of water or energy or whatever it is. But actually what happens is that due to a long course of radiation, there are some indirect effects on, say, on the lip, on the tongue, or in the throat, or, depending on whichever part of the body is getting radiation. Or even the person is not feeling hungry enough. So they tend to lose weight and tend to become weaker. So it's the effect not just of radiation, and there's also the effect of the tumor itself. Suppose somebody is getting a lung cancer or a biliary cancer. These are the cancers which literally release chemicals which cause breakdown of muscles, so-called cachectins. So to answer your question in a short way, that you need to minimize the possibility of side effects, and then you need to manage the side effects, whatever are there, with very good counseling, good patient guidance. You need to take into account who is taking care of the patient, the real stakeholders. You can't just tell, somebody who is probably not going to go home and take care of the patient. You need to bring in the stakeholders.
Even the lifestyle and the nutrition should be also according
nutrition
to that.
Is so important. Nutrition is so important. Taboos of nutrition exist. People talk about not taking your milk you can't take, sugars you can't take. Of course, all of us have to take less sugars. But that doesn't mean that you can't take sugars during cancer.
I've heard that people say that you should not eat anything made up of wheat when you have cancer.
Yes, people say that. But that's wrong. That's totally wrong. I would put this on the camera. I would put this on this podcast. through this through this awards on the behalf of Shodha Medicity, that there is really no harm in taking wheat or sugar during cancer treatment or once you have cancer, because these are not cancer causative agents. Okay, so suppose I tell you that please take less sugar, please take less this thing, because there is some correlation with cancer. That's another matter altogether.
Yes.
Suppose today I build a life where I take a lot of wheat, lot of refined maida, sugars, and sedentary lifestyle. Eventually, my body will become more and more diabetic or diabetic-like.
Yes.
Once I become diabetic or diabetic-like, I will harbor many, many, many reasons to get cancer
Yes.
or other diseases as well. But once you have it and you are supposed to take care of your nutrition, then these taboos don't matter, because in any case you are going to have less food. Less food. So that's because it's not a cancer causative agent.
Yes.
So I'm glad you asked this.
So the next question is, any advances in radiation therapy you would like to discuss?
Okay, so I have discussed the radiation therapy advances a few moments ago, but I'll probably put them in more structured form. So earlier we used to have a target in the body, and we would just map it out using the X-ray or sometimes even CT scan, and would just probably hope to focus it from the outside and would just hit it from one or two sides, and that would be called conventional radiation. That was really bad. Still done in some places or in many places, but that's really bad, because at the end of the day, to treat one area, you are going to give the same amount of radiation to all the surrounding areas. No use. Things moved. We started focusing the same target from multiple directions, throwing little beam from all sides.
Yes.
And we could really focus the radiation dose to that target. But then a lot of precision leads to a lot of errors. You're so precise that you can probably throw errors. So errors started getting corrected by what is called as image guidance. So you would image the tumor before you treat. Another advancement. Very good. But life has moved much beyond image guided radiotherapy now. We are now at surface guided radiotherapy, where we are not just seeing the tumor before radiation, we are seeing it during the radiation as well. Life has moved to what is called as adaptive radiotherapy, where we keep seeing the tumor every day and we adapt the radiation accordingly. We are having what is called as exact track dynamic, where we can see the bones of the surrounding tissues, and we can see the little bit movement, even a little bit movement there, and we can know that okay, this is not correct, and we have the methodologies to correct it there and then during treatment. So things are in radiation therapy getting very advanced, and this advancement is all bringing us to a point where in some cases we can actually shrink the course of radiation from a few weeks to a few days.
So can we talk about the technology advancements at Yashoda Medicity in your specialty?
Certainly. In my specialty, we have what is called as a comprehensive radiation oncology setup, where we have 3 external beam radiation therapy equipments along with brachytherapy. We have what is called as MRI Linac, which is the Electra Unity Linac, which is one of its kind in India. It has integrated comprehensive motion management. It's the first of its kind in India. And this comprehensive motion management helps me during taking the MRI and giving the treatment about, say, respiratory motion of other organs, and so on and so forth. It's very, very unique, very special. Because say, suppose I'm treating somebody's liver and I'm focusing it at just one place. So it's very nice if I know that how much the liver is moving during radiation, so that I can focus accordingly. So that's the first in India. Then we have what is called as Ethos, which is Ethos Hypersight is first in North India. What is Ethos Hypersight? Ethos Hypersight is a technology which creates such amazing CT scans during the course of treatment that, say, a mouth cancer or a throat cancer patient whose large tumor becomes small and suddenly his neck has turned in one direction, that it can pick up, and once it picks it up, it makes sure that the critical organs don't get fired. The critical organs can be a simple thing like a gland or something, but can be very complex like spinal cord, nerves of the eye, and stuff like that. And so the last but not the least, we have Edge with exact track dynamic. Now what is this system? The Edge system is a variant system. Edge helps us focus in the smallest of places, helps us focus from all directions, and exact track dynamic, as I said, can track the tumor right up to the millimeter, so that we can actually make sure what we are imagining that we are giving radiation to is also the thing we are giving radiation to. So we do have a lot of, and we have brachytherapy, the Bravos system, which is the latest of its kind with best instruments, so that we can actually, brachy is basically putting the source into the body. That is required for some gynecological malignancies and some other malignancies. So that is also a big advancement.
So, breast cancer and colon cancer is on the rise. So, what advice would you like to give to the people?
Yes, it's interesting that breast cancer, especially amongst the young people, is rising. The advice that,
And even in the unmarried women, breast cancer is there. So, do you think it's genetic?
no, it's not genetic. So
Okay.
it's interesting that out of all the breast cancers that you have, only 7% are genetic. So most patients that you will see are not genetic. That's one thing. But I'll answer your question about what advice I can give to the people. Well, marrying late is definitely one problem. Why marrying late is a problem then? Okay, that's the next question. It's not about not about anything social. I'm talking medical,
Yes,
right?
exactly.
So when you marry, you conceive. It's about conceiving rather than marriage. It's about conceiving the child. When you conceive the child, there is a certain change in your hormonal chemistry. Once that hormonal chemistry change comes in, the breast tissue is basically glands which are supposed to release milk for the child when the child is born. That changes which happen in that breast tissue make it more and more resistant to cancer. So I don't know if I should say this, but this is a very important part. Conceiving the child. So, that puts you in a certain risk group. Yes. Apart from that, if there is a clustering of cases in the family, like your blood relations are getting breast cancer, or the immediate blood relatives are getting cancer, or if there is people in the same bloodline, two of them are getting it, so then you should start screening for your cancer about 5 to 10 years earlier than them.
And even the cases of cervical cancer are coming up.
Yes, cervical cancer is a problem. I agree.
So I was talking to Dr. J.B. Sharma before you. So he also suggested for the HPV vaccine. So I believe you
I
must
would certainly
convey your
endorse it.
message to the listeners that we have right now.
Yes. So Dr. J.B. Sharma is an oncosurgeon who has a specialty in urogynecology. So he's a very special senior team member of Yashoda Medicity, and I endorse this finding of recommending an HPV vaccine to girls. It's recommended that you give it at 9 years of age or 9 to 12 years of age. So you just give it those 3 doses, and there is a reasonably huge possibility that you will not get a cervical cancer once you have taken that vaccine, because the current vaccines they fight against the 6 variants of HPV which can cause the cervical cancer. So this is what, and in fact 9 variant vaccine is also there. Last month a very nice study has come in, which it was a cohort study where they have reported the benefit of the vaccine in actual population. So earlier reports were about the changes in the cervix, but now it is actually about whether the cervical cancer is happening or not, and there is a significant drop. So if things are done properly, this is one cancer which can probably be eliminated to a huge extent.
Yeah.
It can be eliminated. It's a killer and it can be eliminated.
Because
what else
it
do you
has a
want?
vaccine.
Because it has a
Yeah.
vaccine. Yes. Only cancer
But
which can
it's a
really
relief that more and more people are coming to know about it, and there's an awareness also among the youngsters as well as the married women as well.
Yes.
So thank you so much, doctor, for joining us today. It was really amazing, and to hear from your experience and from your insights, it has been an honor for us. Thank you so much, doctor. Thanks a lot for joining
Thank you.
us.